Hello, I'm Dr. Gopinath Bandari, consultant hand, wrist and microsurgeon. Today we are going to talk about carpal tunnel syndrome. Carpal tunnel syndrome means tingling and numbness of the thumb, index, middle and half of the ring finger. These 3.5 fingers are affected and the patient experience pain or tingling numbness in these 3 fingers distribution because of compression of a nerve called median nerve in the wrist area. This median nerve passes through a small tight tunnel in the wrist and distributes its sensory branches to the fingers. So when the nerve passes through this tunnel, sometimes the nerve may get compressed under the tunnel, either because of some causes externally or some internal causes. When the nerve compression occurs, these sort of symptoms appear. So what happens when a patient experiences carpal tunnel syndrome? Firstly, the patient will have pain in the distribution of these 3.5 fingers, and also there can be some amount of tingling and numbness in these fingers, and this pain can be more, especially in the night times when the patient is sleeping. And which sort of people experience this sort of pain? Usually females are the most affected, especially in the range of 20 to 50 years, or higher aged people around 40 to 50 years people experience this carpal tunnel syndrome mostly, and it can be aggravated due to repetitive stress injuries, or in young people mostly due to hyperextension of the wrist, in example working with a mouse or keyboard continuously, especially in the software engineers this can be there. And in starting stages of the presentation, we can treat carpal tunnels by small splint which can prevent hyperextension, and the night splint for people who have more pain in the night time. And for early presentations, we can manage well with some sort of medications, and when severe complaints are there, we can also give a steroid injection into the carpal tunnel. But for persisting cases, carpal tunnel release is the best option which can give good recovery. Sometimes we do see these carpal tunnel symptoms in post-pregnancy patients or hypothyroid patients, where a lot of water retention happens in the body and the canal becomes narrow because of the water retention. In such patients, usually spontaneous recovery is expected after delivery, and usually the water retention goes down and the nerve is expected to return to normalcy. So that is about carpal tunnel syndrome. Thank you.